Hi, how are you?
I'm good. How are you?
I'm good. I'm Dr. Ivy, and I'm going to be treating you today.
Nice to meet you.
Nice to meet you, too. So why don't you tell me a little bit about your symptoms?
So I've been having some numbness in my left hand and also in my right leg.
So left arm and right leg. When did you notice these symptoms starting?
My arm has been about a week, and my leg, it's just been a couple days, probably like 2 or 3.
Okay. Okay, any other symptoms that you've noticed?
No, just those.
No headaches, blurry vision, any high-pitched noises, anything else?
Sometimes a little bit of headaches, but I'm not sure if it's related to those.
When's the last time you got a headache?
Probably right before the numbness in my leg started. So
like
about 3 days ago.
Okay. And how bad was it? If you would have to rate the level of pain from 0 to 10?
Probably like a 5 or a 6.
5 or 6. So, okay. Did you take any medication for it?
I did.
Okay. What did you take? Ibuprofen?
I just took ibuprofen for it.
Did it help?
It helped a little bit, not perfectly though.
Okay. Okay, so I'm going to be doing a few neurological tests today, and then I'm also going to be just taking a general look at your general health, make sure there's nothing underlying that could be causing this. I'm just going to go ahead and confirm a few of your medical history details.
Yeah, of course.
Can you please confirm your date of birth for me?
It's September 22nd, 2001.
Okay. Your last name?
Johnson.
Okay. Okay. Any chronic illnesses that I should be aware of? Any allergies either to food or medication?
I don't have any.
Any history, family history of diabetes?
No.
High blood pressure? Heart diseases?
No.
Any thyroid
No.
issues in the family? Okay. So that's great. Do you exercise regularly?
Yes, I do.
How many times a week?
Probably 4 to 5.
4 to 5. What kind of exercise is it? Like cardio?
A lot of cardio.
Okay. And how long is each session approximately?
About an hour to an hour and a half.
Okay. That's great. How's your diet?
It's pretty good.
Pretty good. Do you have any dietary restrictions? Any specific diets?
I'm a vegetarian.
Vegetarian.
And I follow that pretty strictly.
Okay, great. When was the last time that you had any blood work done?
About a year ago.
Okay. So I'll probably have you do some blood tests just to make sure that everything's good. Okay. Do you smoke or have you ever smoked?
I do not.
Okay. Any recreational drug use?
No.
Any alcohol consumption?
Occasionally, not very often though.
Okay. How many times a month would you say you drink?
Maybe about 4 or 5.
Okay. And how many drinks would you have?
Only about like 1 to 2 small ones every time.
Okay, great. Okay, so I'm going to start taking your vital signs. I'm going to be placing this on your arm to take your blood pressure. You can go ahead and rest your hand. Okay, placing this on your finger. Can you go ahead and uncross your legs for me? temperature. Okay, 97.5. Okay, oxygen 96, heart rate 91. Heart rate's a little bit elevated for resting position. Do you feel any palpitations? Are you shortness, any shortness of breath or
Not
anything?
really, no.
Okay. Okay, blood pressure is 116 over 86, which is a little bit elevated. Okay. Second pulse reading is 80, so that's more normal. Remove this. I'm just going to slide this. Okay, I'm going to start taking a look at your eyes. So along with the neurological tests that we're going to be doing today, I'm also going to be checking your cranial nerves. And that includes vision, smell, taste. Okay, so I'm going to have you look here at my finger first. And I'm just checking the dilation of your pupils. Okay, they seem to be very symmetrical. They're round and reactive to light. That's great. Pupil size is normal. Okay, we're going to be doing vision tests.
Okay.
So I'm going to be giving you the Snellen chart. Can you hold it at arm's length, and then you're going to grab your left hand and cover your left eye? I see that you're wearing contacts, right?
Yes.
How does that look? Can you read
It
all
looks
the...
good.
Okay, can you read this last row for me?
L T F P H.
Okay, perfect. Can you read this one starting on the right?
J H D F C.
Okay. Now, can you tell me what word is this one?
Angle.
Okay, this one.
Without.
Okay, and the first one here at the top.
Hold.
Okay. What color do you see this line?
That is red.
Okay, and this one on the side?
That's green.
Okay, perfect. So now we're going to switch sides. I'm going to flip this around. You can go ahead and grab it. And now cover your right eye for me. Okay, you can go ahead and extend it at arm's length. And now go ahead and let me know how does that look. Can you see all these rows here?
I can't see the very smallest two, but the other ones are good.
Okay, go ahead and read this one for me.
9, 3, 7, 8, 2, 6.
Okay, and this one starting on the right.
3, 7, 4, 2, 5, 8.
Okay, perfect. Can you tell me what number is this one?
That's 9.
And this one?
8.
Can you tell me which circle is bigger?
The 9.
Okay, very good. What number is this?
That's a 4.
And this last one here?
5.
Okay, the first one in this row.
4.
This one right here.
That's a 2.
Okay, perfect. So your vision is 20/20. That is great. Now I'm going to be taking a look at your optic nerve. Go ahead and you're just going to look straight ahead. I'm going to get close. Take a look at your retina. Just trying to focus. Okay. Retina looks in really good shape. I don't see any scratches. Okay. I'm actually going to put on my gloves to examine around the eyes. Okay. Go ahead, look straight ahead. I'm just going to check the conjunctiva. Go ahead and look down for me. Okay, very good. Everything looks great. Okay. Okay, go ahead and look up. Okay, go ahead and look down. Okay, perfect. Okay, now I'm going to be checking your eye reflexes. Go ahead and look in front. I'm just going to stroke. Okay. Okay. Go ahead and open your mouth. Okay. You can go ahead and say, Okay, that's what it looks in really good shape. Gums are normal. Okay, now you can just go ahead and relax. I'm going to be palpating your face and your head. Okay. And go ahead and clench your jaw for me. Okay, masseter muscle is normal. And go ahead and relax. Okay. There's no inflammation. Okay, I'm checking your lymph nodes. You go ahead and shrug your shoulders for me. Okay, good. You can go ahead and relax. Okay. Any pain as I'm palpating here down your left shoulder?
No.
And the numbness, you haven't felt that on the shoulder, it's strictly on the arm?
Not on the shoulder, just on my arm.
Okay. Okay. I'll go ahead and check the range of movement. Go ahead and squeeze my hand. Okay. Now try to pull my fingers with your... Okay. Now try to push my hands down. Okay. Relax. Now try to push my hands up. Okay. Now you're going to try to spread your fingers. Okay, now go ahead and spread them and try to resist. Okay, now try to hold your hand right there. I'm going to try to push it down. Resist. I'm going to try to push it up. Okay, great. Just going to check the range of movement on the hand. Okay. Just want to have a baseline of what your normal is. Go ahead and relax. Okay. I'm going to be checking this side. Okay, we're going to do the same tests. Go ahead and squeeze my hand. Okay, now go ahead and try to pull my fingers with your fingers. Okay, now go ahead and try to push my hand up. Okay, now go ahead and flip. Try to push my hands down. Okay, so strength's a little bit reduced in this arm. Okay, go ahead and check the joints. Okay, any pain there at all?
A little bit.
Where do you feel the pain?
On this side.
Okay. Does it get worse if I press on it?
A little bit.
A little bit. Okay. Okay. Now try to hold your hand right there. I'm going to try to push it down. Okay. I'm going to try to push it up. Okay. Now try to spread your fingers. Okay. Now spread the fingers. I'm going to try to... Okay. Okay, I notice you have a scar here. Have you had surgeries before?
I did have one about 10 years ago.
Okay. Okay. Can you try to bend it as far as it goes? Okay, so that's a pretty good range of movement. Okay, now I'm going to move the shoulder joint, just... Okay, everything feels normal here?
Yes.
No pain? Okay, so now when you feel this numbness, can you pinpoint what area you feel it in, or is it just like
Kind of
overall?
like this side of my arm and this side of my
Okay. Okay, so I'm going to be doing some sensations tests right now just to make sure that if we can pinpoint exactly where the numbness is. Okay, first we're going to do a very simple test. This one's going to be a sharp or dull sensation. So this one's going to be sharp and this one's going to be dull. Okay, and I just want you to let me know which one you're feeling.
Okay.
Okay, you can go ahead and close your eyes for me.
Sharp. 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 Dull. 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 Sharp. 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 Dull. 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 Dull.
Okay, I'm going to hold your arm right here.
Sharp. Sharp. Dull. 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 Sharp. 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 Dull.
Okay, let's go ahead and flip your palm up.
Sharp. Sharp. Dull. 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 Sharp. Sharp. Sharp.
Okay. And test the other arm. We'll just go ahead and hold it right here.
Sharp. 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 sharp, 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 dull, 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 sharp, 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 dull, 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 dull.
Okay, so it seems that you're still very perceptive of sharp or dull sensations. So now I'm going to be touching your skin with this cold object that just feels cold. And I want you to tell me if you feel it on your right or your left side of the body. Okay?
Left,
Okay.
right, both,
Okay.
left, right, left, right, left, 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 left,
Okay.
right, right, left, both,
Okay, very good. Okay, I'm going to be applying some water to one of these cotton pads. Go ahead and close your eyes, and I want you to tell me if it feels dry or wet.
okay, wet, 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 dry, 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 wet, dry, wet, 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 dry, wet, wet, dry, 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 wet, dry, dry.
Okay, that was perfect. Now we're going to be doing something similar to the cold sensation. I'm just going to be touching either left, right, or both.
Okay.
There's just a different sensation. It's just a brush, okay?
Okay. Right, left, 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 right, left, right, 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 left,
Okay.
left, left, right, 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 left,
Okay. Just going to hold this.
left, 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 right, right, left, left.
Okay. Okay, this is something similar. I'm gonna be applying pressure to your skin either with one or both of them at the same time. So you can just say one or two.
Okay. 2, 1, 2, 2, 1, 2, 1, 1, 1, 2, 2, 2, 2, 1, 1.
Okay. Now I'm just gonna check your reflexes. Okay. have you just try to just let it hang. Okay. Go ahead and rest. Now go ahead and just let your jaw loose. Now I'm going to be doing a different test. This is a tuning fork. It makes a vibration. I'm going to show you. Just feels like a vibration. And I'm going to be placing this on some of the bony prominences like the shoulders, maybe the jaw, elbows, somewhere along the wrists. And I want you to tell me when you start feeling it and then when it stops. Okay?
It started. Stopped.
Okay.
Started. Stopped.
Okay.
Started. Stopped. Started. Stopped.
Okay.
Started. Stopped. Started. Stopped.
Okay.
Started. Stopped.
Okay.
Started.
Okay, just hold your hand right there.
Stopped.
Okay, very good. Go ahead and relax. Before we continue, I'm just going to finish. I did not check your ears, and that's part of the cranial nerve exam we want to do. So I'm just going to have you relax, and I'm going to be making a sound close to your ears, and just tell me if you feel it, if you hear on the left or the right.
Right. Right. Left. Left. Right.
Okay, now I'm going to be giving you two options. This is going to be option A, and this is going to be option B. You tell me which one's louder.
Okay.
Okay. This is option A, and this is option B.
Option A is louder.
Okay, perfect. That's option A. This is option B.
Option B is louder.
Okay, perfect. Okay, Amanda, I'm gonna give you a patient gown so I can be checking your back and your legs.
Okay.
Okay, I'm actually gonna start just checking your head. Just gonna be palpating. Okay, the scalp looks okay. The head is normal, no masses, no inflammation. I'm going to be putting your hair up just to keep it out of the way. Is that comfortable?
Yes.
Okay. Okay, I'm going to be opening the gown to have access to your back. Okay. Sometimes that numbness you experience on the legs or the arms could be a nerve being pinched on the spine, so we want to make sure. I don't really notice any inflammation, so that's good. I'm going to be doing a test. I'll be tapping along your spine. If there's any pain, or if you feel any shooting pain, or any just weird sensation that it's not just the tapping on the skin, let me know. Anything there?
No.
No? Okay. Okay, so we're going to be doing similar tests to the ones that we did on your arms and your face. I'm going to start with a sharp or dull, okay?
Okay. Sharp. Sharp. Dull. 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 Sharp. 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 Dull. Dull.
Okay, I'm going to be sliding the sharp object all along your spine. Let me know if there's any area where it feels numb or just different. Did you feel that continuously?
Yes.
Yeah. Okay, now let's try the dull. Did you feel that continuous as well?
Yes, I did.
Okay, perfect. Now we're going to be trying the cold objects. I'm going to be touching either the left, the right, or both sides.
The right. Left. Right. Both. Right. Left. Left. Right. 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 Left.
Okay, I'm going to slide this along the back. Let me know if it feels continuous or there's a spot where it feels less cold or warm.
It feels continuous.
Okay, I'll do that one more time. Continuous as well?
Yes.
Okay, perfect. Now we're going to be trying the 1 or 2 pressure points. This is going to be 1, this is going to be 2.
Okay.
Okay?
1. 1. 2. 2. 2. 2, 2, 1, 1, 1, 2, 1, 1, 2, 1.
Okay, now go ahead and let me know if this feels wet or dry.
Wet, wet, dry, dry, wet, 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 dry, 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 wet, wet, wet.
Okay, perfect. Okay, it seems the spine is healthy. I don't really notice any neurological issues here. I'm gonna go ahead and just listen to your lungs really quick. Can you go ahead and take a deep breath for me? Take a deep breath again. Okay, one more time. One more time. Okay. One more time. Okay. One more time. Okay. Lungs sound clear. Okay, now I'm going to have you lay down on the bed for me, please. You can place your head on this side. Okay, I'm just going to be palpating the legs, looking for any signs of inflammation. When you feel that numbness, is it closer to your hip? Is it closer to your ankles? Which part of it?
It's closer to my ankle.
Okay. Okay. Can you go ahead and try to push my hands with your feet? Okay. You said it's your right leg mostly, right?
My right, yes.
Okay. Go ahead and just check the mobility of the ankle. Is there any feeling of like pinching somewhere on the ankle joint or?
No, not pinching.
No. Okay. Okay. I'm going to be checking your perception of sensations, different sensations. We're going to do similar tests as we did before. Go ahead and tell me if this feels sharp or dull.
Sharp, 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 dull, dull, sharp, dull, sharp, 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 dull, 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 sharp, 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 sharp.
Okay. Okay, I'm going to be sliding a cold object along your leg. Let me know if there's any spot where it just feels different temperature.
A little bit by my ankle.
Okay. I'm going to do that one more time. Let me know if it's the same.
Yeah, it's the same.
Okay. Let's try your left side.
That one's fine. That's the same.
Okay, perfect. Okay, So now we're going to be doing 1 or 2 pressure points.
1, 2, 1, 2, 1, 2, 2, 2, 2, 2, 2, 2, 1, 1, 1, 2, 2, 2.
Okay. Now go ahead and tell me if you feel this on the right or the left leg.
The right, the left, both, right, left, right, left, both, both, right, right.
Okay. Okay, now go ahead and let me know if there's any shooting pain, any pinching or tingling. Any abnormal sensations there?
A little bit on my right ankle,
On the outer part or the inner part?
on the outside.
What's that feeling? Is it like a tingling? Is it like a pinching?
It's a little bit of both.
Okay. I'm going to be checking your Babinsky reflex as well. Okay. Okay, now we're going to be doing the wet or dry test.
Wet, 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 dry, dry, wet, 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 dry, dry, wet, 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 dry, 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 dry.
Okay. And again, just tell me if you feel this on the right, left, or both.
The right, left, both, right, 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 left, left, right, right, left, left.
Okay, perfect. Okay, Amanda, you can go ahead and sit back up on the bed, please. You're going to be facing that way. I did not really find any neurological disorders that could be causing this. Your spine looks healthy. There's no indication that's being caused by a nerve issue. So I think the next step is I'm going to have you take some x-rays. And once I get those x-rays, I can take a look at them and just make sure that there's nothing else going on with the joints, okay? If that doesn't give us any more information, we'll figure out what other tests we can do.
Okay.
Okay, so I'll send you the order for you to go get those x-rays done. As soon as I get them back, I'll let you know.
Okay. Thank you.
Well, it was very nice meeting you. Do you have any other questions right now?
Not that I can think of, no.
Okay. Well, it was very nice
Nice meeting you.
Bye.